Hello, this short presentation is just a brief introduction to therapeutic ultrasound. So ultrasound has been part of clinical practice since sometime back in the 1950s, and it remains a popular and evidence intervention for a range of clinical problems. Ultrasound is a form of mechanical energy, not electrical energy, and therefore, strictly speaking, it's not really an electrotherapy at all, but it does fall into the electrophysical agent grouping, EPA. So with an ultrasound, mechanical vibrations at increasing frequency is known as sound energy. The normal human sound range is from 16 Hz to something approaching 15 to 20,000 Hz in children and young adults. Beyond this upper limit, the mechanical vibration is known as ultrasound. The frequencies used in therapy are typically between 1 and 3 megahertz. So 1 megahertz is 1 million cycles per second. So how does it produce ultrasound? The piezoelectric effect of ultrasound is like magic with crystals. Imagine you have a special crystal, and when you squeeze or apply pressure to it, it starts to produce tiny electrical signals. This crystal can also do the reverse. If you apply an electrical signal to it, it will change its shape slightly. Now think of this crystal as part of the ultrasound probe that touches your skin. When you receive an ultrasound treatment, the machine sends electrical signals to the crystal in the probe, the head of the ultrasound. This causes the crystal to vibrate very fast, creating sound waves that are too high pitched for us to hear. These sound waves travel through your body and bounce off different tissues like muscles, ligaments, and tendons. So how does it transfer through the tissues? So all materials, tissues will present an impedance to the passage of sound waves. The specific impedance of a tissue will be determined by its density and how elastic it is. In order for the maximal transition of energy from one medium to another, the impedance of the two mediums or media need to be as similar as possible. Clearly, in the case of ultrasound, passing from the ultrasound machine to the tissue and then through the different tissue types, this cannot actually be achieved. The difference in impedance is greatest for the steel and air interface, which is the first one that the ultrasound has to overcome in order to reach the tissue. To reduce this difference, a suitable coupling medium has to be utilized. Even if a small air gap exists between the transducer, so the ultrasound head, and the skin, the proportion of ultrasound that will be reflective approaches 99.9%, which means that there will be no effective transmission. So let's talk about the coupling medium that is used in ultrasound. This can include water, various oils, creams, and gels. Ideally, the coupling medium should be a fluid, so as to fill all the available spaces, relatively viscous so that it stays in place, and it has an impedance appropriate to the medium it contacts, and it should allow transmission of ultrasound with minimum absorption or disturbance. At the present time, the blue gel-based mediums are preferred to the oils and creams with ultrasound. Water is an effective medium and it can be used as an alternative, but it doesn't meet all of the above criteria. If you require extra resources on ultrasound or any other electrotherapy modality, there's a great site by Professor Tim Watson, and I've included the links in the comments.